And this is normally on the left side over here. This side over here is showing you that you see the connective tissue in here. There's straight tubular glands, but the connective tissue between those tubular glands, that's about the number of nuclei you see. And then we've got a region right here, we've got more nuclei pushing down here even into the smooth muscle layer a little bit, isn't it? Can you see where there's more nuclei in this region here than over to the left or the right? Okay? See more nuclei, lymphatic tissue, no nodules, so diffuse lymphatic tissue. Okay, does that make sense? And once again, you may be looking at large intestine, and all of a sudden I just see a region like that. Oh, I've got diffuse lymphatic tissue, plenty of bacteria, within the large intestine. Well, they've made their way into the connective tissue there through the epithelial lining in the connective tissue, and you've got an immune response taking care of it. All right, but look right here. This looks like could be the esophagus, hard to tell, but could be the esophagus. And we've just got this region. A lot of little spots down in this region here, little spots in here that have more nuclei than they should. Okay, that's diffuse lymphatic tissue. All right, and this is just the one I put up before. They have it on their side on the website, so I left it on the side. Just a lot of more dots in here. I wish they had taken a little bit lower power magnification so you could see left or right, or should say top or bottom, where there wasn't as many of the dots in there, not as many nuclei, so you could definitely see we're talking diffuse lymphatic tissue. Okay, here's the stomach right here. You don't have to recognize it per se, but you look over here, this is normal in terms of the connective tissue among the glands. And I've got over here, boy, that's probably nodular lymphatic tissue without a germinal center, isn't it? Okay, question? It's probably more macrophages in there than normal, a higher concentration of macrophages. You haven't recruited enough T cells and B cells yet. Okay? This is pretty close to being nodular. I mean, it's not always black and white nodular diffuse. This is getting enough where I'm seeing a nodule, starting to see a nodule there, starting to see a nodule there. So that's pretty close, if not yet being nodular. Okay, same kind of thing here. See, I've got an epithelial lining up here, little villi from the small intestine coming off. That's pretty close to being a nodule, isn't it? Okay. Continuum really from strong diffuse into nodular.
So when you say it's pretty close to being a nodule, do you still mean that it's still diffuse?
I'm not going to draw that line. Okay, I'm not going to. If I have that here, what is the region? What is the region here encircled? I'm not going to give you both diffuse and nodular on that because it's not real clear. Okay. Previous ones, that's definitely diffuse. Okay. And that's the whole thing that I want you to realize. If diffuse isn't enough to fight out that infection, it will become nodular. And if nodular is enough, it'll be a nodule with a germinal center. But it can stop anywhere along that continuum if I fight out the infection. Let's get rid of much of my clonal army and diffuse the remaining cells. Okay, now, nodules. All right, here's a nodule right here. Circling one nodule. Got a lighter staining germinal center to it, and there's diffuse lymphatic tissue out in here, isn't there? All right, same thing here, just a little bit of a different stain. I've got a single nodule here. It's got a germinal center to it, and then there is diffuse lymphatic tissue, right here in say the lower right-hand corner. Some good diffuse lymphatic tissue. All right. Here is one that's really embedded within diffuse lymphatic tissue. So I really have trouble making out the outer edge of a nodule, don't I? But I do make out that germinal center in the middle there. Okay. Starting to get a little bit redundant here, but here is a nodule. Got a lighter staining germinal center. This is probably from a lymph node because that looks like a cord right there, medullary cord, doesn't it? So I'm right at the border between the cortex and medulla, most likely with this slide. All right, if I take a look here, got a nice cap on the outside, but here is a nodule, and I'm having trouble identifying the outer edge of that nodule, but I can see the germinal center, can't I? Okay. Germinal center right here is staining ladder, looks much better on my computer screen than it does up here on the TV screen. And then, you know, I've got a nodule here. Once again, the diffuse lymphatic tissue blends into the edge of that nodule, so I have trouble really defining the outer edge of the nodule. And that's true particularly in lymph nodes and tonsils, where that can be an issue. All right, now we'll go into organs, starting off here with tonsils. You don't have to tell me it's a palatine tonsil, but you can see here it's got a stratified squamous surface, correct? But thing that jumps out at me is I'm definitely lymphatic tissue. I can see nodules with germinal centers, plenty of diffuse non-nodular lymphatic tissue in here, and I've got right here a crypt coming in. And no other lymphatic organ has a crypt like that coming in. I will always show you a crypt. I mean, if you get to some sites, they may show you, you know, just a part of a tonsil and you can't see a crypt and say this is a tonsil. I will always show you a crypt if I want you to identify it as a tonsil. Okay? If I look here, once again, I see tons of lymphatic nodules with germinal centers, plenty of diffuse lymphatic tissue surrounding them, and then I've got a crypt coming in. You can see it even starts to branch a little bit right here. But that crypt coming in like that tells me that that has to be a tonsil. This thick connective tissue layer I see right here would be my hemicapsule. All right, once again, I look here, I can definitely make out nodules with germinal centers. There's 1, 2, here's 3, and really the germinal centers are what helped me identify that as a nodule, isn't it? Because it blends into the diffuse connective tissue surrounding it. I look here, it's got a surface, looks like an epithelial lining versus connective tissue capsule. Here I've got a crypt coming in right here. There's another little tiny bit of a crypt coming in right up here in the upper left-hand corner. Crypts tell me I have to be a tonsil. Okay, same thing here. I see nodules with germinal centers. I see a crypt coming in, I've got to be a tonsil. All right, lymph nodes. Very, very low power magnification of a lymph node. In fact, this may even be a demagnified image. You're used to your objectives being, you know, at 10x to 20x or whatever. You can actually have some that are in negative 3x. They're not common, but they're demagnifying lenses. And if I say so, it's a demagnifying view of this actually. And you can see the idea that there's a lymphatic vessel here running through connective tissue that has 1, 2, 3 lymph nodes right in a row. But we look at it, even low power, I can get the idea that I've got an outer cortex and an inner medulla, and staining very darkly, the cortex in particular, staining very darkly with lymphatic nodules in that. It's got to be a lymphatic nodule. No hint of the crypts coming in right here. In fact, I've got a cortex and medulla, and the majority of my nodules that I see very well are out at the very edge of that cortex. All right, more of a low power, true low power magnification here. If I take a look, first thing that jumps out at me is I know I'm looking at a lymphoid organ, say nodules with germinal centers, correct? If I look on the outside of that, I've got a capsule, not an epithelial item, but a capsule, and just deep to that I've got a subcapsular sinus, don't I? Okay, no crypts, not a tonsil, capsule, subcapsular sinus, I want to think a lymph node. Then I look and say, gee, I've got all my lymphatic nodules here in my cortex. Here's my lighter staining inner medulla. It's got medullary cords to it. The majority of nodules are just underneath that subcapsular sinus. All right, if I take a look here, once again, maybe not as active, but I see a nodule right here. Maybe a slight hint of a germinal center in the middle. Here's a nodule out here without a germinal center, a nodule without a germinal center. So I'm looking at a lymphatic organ. I see a capsule out here, and I see a subcapsular sinus, don't I? Capsules, see, first of all, I say, this has to be a lymphoid organ. I see a capsule with a subcapsular sinus, that would say a lymph node. I have no hint of any crypts coming in. I do catch a little tiny bit of medulla down here in the corner, but not much. Okay. Here's one higher power magnification. Nice big nodule right here with a germinal center to it. A little tiny bit of a nodule up here in the upper left-hand corner. Tiny bit of a nodule with tons of diffuse lymphatic tissue. When I look towards the surface, I see a capsule, a subcapsular sinus. That tells me I've got to be in a lymph node. Nothing else has a subcapsular sinus to it. All right. If I take a look here, I can see lymphatic nodules up here. No germinal centers to them necessarily, but lymphatic nodules. I can then make out a capsule, and I can make out a subcapsular sinus below it. And it's a low enough magnification, I can make out that my nodules are all up here in the cortex, and then down here is my medulla that contains the medullary sinuses, along with the medullary cords of lymphatic tissue. The cords will be down here within the medulla. The cords are the dark structures, the dark lines, thick lines of lymphatic tissue.
Is there the T cell dying structure that you're on this?
No, okay, are you thinking of Hassel's corpuscles? Those are in the thymus.
Oh, okay.
Yeah, and that's one, yeah, maybe I'll look at this and, are these Hassel's corpuscles? If you went to higher power and find focused on them, you'd say, no, they're not. Okay? Okay, we'll come up to spleen. I'll kind of illustrate differences as well. Okay, here we are, spleen, the thymus. Spleen's next, and we'll get to thymus. All right, spleen, nothing jumps out at you and says on the spleen, but you do look at it, you see lymphatic nodules in there. Those lymphatic nodules, a little bit tougher on this one right here. I do see a tiny bit of things. I don't see the capsule. Yes, I do. Once again, why did they just show you a little tiny bit of capsule? Why not show more capsule coming across here? As the capsule's coming across, there is no subcapsular sinus. Okay? Doesn't get lymph, it gets blood, right? From the splenic artery. Okay? And so there's no subcapsular sinuses. And then the lymphatic nodules are just scattered around. In a lymph node, they're going to be concentrated just underneath that subcapsular sinus, just underneath the capsule, whereas in the spleen, they tend to be scattered about a good bit more. Also within the spleen, we don't see medulla. We do catch some trabeculae coming in, pink connective tissue trabeculae coming in, that we don't typically see so much within the lymph node. The white pulp refers to the lymphatic nodules. In the spleen, a lymphatic nodule is white pulp. Whether it has a germinal center or not, a nodule is white pulp. All right. Now, this is spleen. This is not what I'm going to ask you per se on spleen because it's too high a magnification. This is just showing the fact that whenever we're in a nodule, and you get the idea, I've got a lot of nuclei out here, I'm in white pulp, I'm in a nodule, you're always going to find your central artery. Because remember, the white pulp develops in the tunica adventitia of that central artery. Okay? And once again, if we were doing this with a microscope, I'd have you, when you look at spleen, go to higher power on that white pulp and find that central artery inside of it. All right, very low power magnification of spleen. Once again, probably a demagnifying. If I look in there, though, I do see lymphatic nodules, correct? And those lymphatic nodules, they're not packed tightly like they are, say, within a tonsil or a lymph node for that matter. They're scattered throughout, aren't they? Okay? And when I see something like this, where I've got lymph nodules scattered throughout, that tells me I'm spleen. The nodules are the white pulp, Everything else in there is the red pulp. Okay, questions?
Can you help us point out, are these all lymphoid nodules or any of them?
Right in here, on this slide, this is a very low amount of pigmentation, so all of these dark staining structures here are lymphatic nodules. All of those are white pulp if we're using that's the white pulp of the spleen. Anytime I'm over in a region that's not a nodule, or it could be in the white areas in here, that's gonna be the red pulp. There is not a medulla within the spleen. This is because it's a low power magnification, it's whiter in the middle here. Typically, you don't see that, you see something more like this right here. Okay? There's not a defined cortex medulla for the spleen. There will be for thymus, there will be for lymph nodes. There's not one for tonsils. Okay? Now, if you look right here. This is one where I say spleen doesn't jump out and say I'm spleen, but if you look at this closely, I begin to see, here's the lymphatic nodule right here, the germinal center. Here's the lymphatic nodule, here's the lymphatic nodule with the germinal center up here, so I'm in a lymphoid organ. I come out here, I've got a capsule to it, but I don't have any hint of a subcapsular sinus, do I? Okay, nor do I have any hint of crypts. I do see a trabeculae coming in partially here, but it's not providing lobules. All of these tell me I'm looking at the spleen. I've got nodules, that would be my white pulp, here's red pulp right here. But if I've got a capsule, spleen has a capsule, unlike a lymph node, it doesn't have a subcapsular sinus. Unlike a tonsil where it really doesn't have a capsule on the surface here, it's got epithelial tissue, okay? Even if you don't make that out, I see no hint of crypts, okay? So it can't be a tonsil. Both lymph nodes and tonsils, they don't just have kind of randomly placed lymphatic nodules. They've got a lot more of them, and particularly within a lymph node, they're just underneath the capsule, aren't they? All right, here's another way. Once again, spleen does not jump out to identify itself, but I look, I see lymphatic nodules with germinal centers. Okay, I don't see any edge in here in terms of a capsule. I do see a trabeculae running here with a large blood vessel in that trabeculae, don't I? Connective tissue trabecula right here with a large blood vessel in it, which wants to make me say spleen. The other thing is these nodules are not just underneath the capsule, like they would be if it was a lymph node, nor are they packed real tight. They're kind of diffused. They're not packed tightly in there, are they? Like they would be when they're tonsils. Okay? And so even though I'm just in the middle, I've not seen anything, you should be able to identify this as spleen. Okay? The lymphatic nodules, the white pulp scattered around, it's not that abundant as the nodules would be within a lymph node or a tonsil. All right, thymus. All right, thymus has an outer cortex, inner medulla, no nodules. Okay, the other thing it has is good lobulation, almost complete lobulation. Okay, and we can see that here, can't we? We can see the idea of it separating into lobules from the capsule here. We see a dark staining outer cortex, a lighter staining inner medulla, okay? And we don't see nodules in there, do we? We see plenty of dark, which would be all T cells in this case, but we don't see it forming nodules. All right? And this is composite, one slide here, one slide here, one slide here. The top one going across is our best one of these. All right? This is looking down deeper within the medulla. These are the Hassel's corpuscles that we're looking at. Now, the one I showed you in lecture, that was, on a scale of 1 to 5, that was a 5. Okay? This is the 3s you more commonly see. Okay? You recognize them by location, and once again, this is just a high power, so you can't necessarily do that here. You can't really look at this. If I were to give you this and once you know that's thymus, you couldn't tell me a whole lot of difference between this and the medulla of a lymph node, could you? I'm gonna show you something that shows those Hassel corpuscles better so you can identify them. You can say I don't really see medullary cords, which you won't see here, that you'll see in the medulla of a lymph node. All right, here if I take a look, I see dark staining tissue, so I want to think lymphatic tissue. Now, what some people do is say, here is a lymphatic nodule with a germinal center. Now, if you look at it though, that's trabeculate coming in off the capsule right here. This is a lobe. In this case, the lobe actually has a cortex and a medulla. That's not that common. You look over here, I've got something that doesn't fit that anymore. The fact that I'm dividing it into lobes or partially dividing into lobes here is not something you're ever gonna see within a lymph node, okay? The fact that it's got lobulations to it, don't get caught up in that, realize that this is a lobe because it's separated out. It's not a lymphatic nodule. This is a lobule then of the thymus. Nothing else in terms of the immune system is divided into lobes like this. And you're talking about a cortex and a medulla. If you were to have trouble with that, well, all of a sudden, what is this up here that looks very different? But look at how it's divided into lobes. You don't find anything like that in a lymph node, which is what you might confuse this with.
Would crypts on a tonsil not like connect like that with that? Continuing down, or
If I look here, I've got tissue running through this. Crypts are open. Crypts are always open. All right, if I take a look here, I've got a capsule. That capsule, first of all, when I look at the capsule on the thymus, it's not that dense rate connective tissue like spleen or lymph node. Okay, so that's kind of a clue. If I look here, I've got dark staining tissue. I've got a cortex and a medulla. Now, this one I might look at and want to think, oh, that looks like a crypt. But if I look at it, there's material from the capsule coming in, isn't there? It's not really an open crack, a true crypt in here. In fact, I've got a cortex and medulla. When I look in the medulla, I can see a lot of structures. Now, I can't definitively say, oh, that's a Hassel's corpuscle. Once I identify this as thymus, I can say, oh, those are Hassel's corpuscles in the medulla. Okay? All right, here's a high power of I'll say a 4, maybe in terms of a Hassel's corpuscle. I see plenty of T cells surrounding it here, lymphocytes surrounding it, and here within the medulla, I've got structures. I get a little bit of a hint of cells, the epitheliocytes being wrapped around each other. Once again, that swirling effect, maybe it's seen better in this slide right here. The one I showed you from your textbook is as good as it gets. Okay? All right, if I look right here, here is a thymus that has involuted a little bit. How do I know that? Look at all the adipose. They're labeled, I've got 3 with the adipose, but you see plenty of adipose tissue in there moving in. It's divided into lobes. Maybe the adipose tissue is dividing some into lobes, but the lobe here has an dark outer cortex, a lighter inner medulla. If I want to look at that and say, is that a lymph node with a cortex medulla? I don't see nodules in here, do I? I'm always going to see nodules. The capsule looks different. In fact, I've got adipose. That's just saying this is a 20-year-old. This might be your thymus or maybe a teenager's thymus, let's say, where it started involute, but it still has a good bit of the structure to it. All right, and that then brings us into the